The Black Death was a crippling bubonic plague outbreak that swept through Europe and Asia in mid-1300s. When 12 ships from the Black Sea docked at the Cilician port of Messina in October 1347, the plague arrived in Europe. People gathered on the docks were met with a shocking surprise. The majority of the sailors on board were dead, and those who were still alive were gravely ill and covered in black boils, oozing blood and pus. The fleet of death ships was ordered out of the harbor by Cilician officials, but it was too late. The Black Death would kill more than 20 million people in Europe over the next 5 years, almost one-third of the continent's population. Patients with bubonic plague experience a fever, headache, chills, and fatigueness, as well as one of more swollen, tender, and sore lymph nodes, also called as buboes. The bite of an infected flea normally causes this type. The bacteria multiply in the lymph node closest to the human body entry point. The bacteria will spread to other areas of the body if the patient is not treated with necessary antibiotics. Doctors were utterly unable to prevent or cure the plague during 1347 up to 1350s epidemic. There were a variety of remedies available for those who believed in Greek humor, such as blowing your nose or clearing your throat was a way of getting rid of much cold phlegms, whereas bloodletting, intentionally bleeding a vein, was a way to minimize hot blood. To balance wet, dry, hot, and cold in your diet, such as mustard, mint sauce, applesauce, and horseradish were used. Unlike the devastating bubonic plague outbreak in Europe, the plague is now curable in a majority of cases. Antibiotics can be used successfully to cure it, and according to CDC trusted source, care has reduced mortality rates about 11%. Antibiotics are more effective if taken within 24 hours of the onset of symptoms. Patients should be provided oxygen, intravenous fluids, and breathing assistance in extreme cases. It is important to be handled as soon as possible because a delay in obtaining antibiotics raises the risk of death, said by Capagoda. Antibiotics are often given to people who haven't yet contracted the plague but have come into contact with an infected animal or human. An outbreak of bubonic plague in China has sparkled fears for the Black Death will return in force. However, thanks to antibiotics, doctors believe the disease isn't nearly as lethal as it once before.